Okay, today's dear student, today's our lecture is about chest pain, and it is one of the important lecture in your diagnosis, medicine, or any other subject. So, chest pain, you will often see the patients presenting to you in the clinic or in the hospital or anywhere, and they will be complaining of the chest pain. So, chest pains. There are a lot of causes, lot of problems of the chest area. There's a lot of organs in the chest. So we should be very clear about these chest pain, what what thing is causing this pain and how to deal with it and to reach to the accurate diagnosis. Okay, so grasp. What you have to grasp in this lecture, the number one, the location of the chest pain, the nature of the extent of the pain factors including incentives, aggravating and migrating factor, duration and concomitant symptoms. So first thing, what does it mean is that the location of the chest pain is the key thing that you have to grasp, that whether this pain is aggravating with the, what are the factors that are increasing the pain, what are the factors that are decreasing the pain, and whether this pain is migrating from one location to other location, and the duration of the pain, that how long this pain has been started, right? So this is the first thing you have to find. After the first thing, the second thing is the chest pain interrogation point, and then familiar, the cause of the chest pain, and then the next is the pathogenesis of the chest pain. So in the next slide, I will explain in detail. Okay, types of chest pain. Because heart diseases is the leading cause of the death. All of you know that these days the heart attack and these diseases are too much. So what is the leading cause of the death? It is important to diagnose the cardiac etiology of the patient presenting with the acute chest pain. Because the patient who are in the clinic, the first thing you have been chest pain, you have to exclude the chest pain, because the reason is that this is the leading cause of the death. So first you have to work rule out the heart condition, but do not forget that certain non-cardiac diseases or causes may be life-threatening as well. So first priority you will be giving to the cardiac heart. Okay, after that you will be finding out the or rule out the other things. Etiology. Etiology will be like there will be the chest wall diseases, cardiovascular diseases, respiratory diseases, mediastinum diseases, and other. So these all diseases at the same time can be the cause of chest pain. Like for example, chest wall diseases, like for example fractured rib or muscle torn or something like that, they can be the chest wall diseases, outer surface of the chest. And then there will be the lung conditions. So some diseases of the lungs can also cause you pain in the chest. Other diseases are gallbladder problems. So gallbladder problems can also be the cause. The pain can migrate to your chest, and some gastroesophageal disorders can also cause you chest pain, and pancreatic problems, they can also be causing chest pain. So these all conditions you have to keep in mind, that all these things can be a possible cause of chest pain. These are the non-cardiogenic chest pain causes, right? Chest wall diseases. So now we will detail with full detail. We will check what are the chest wall diseases, like acute dermatitis. Like for example, there's a skin condition, right? Dermatitis is so what happened that this can also cause you chest pain, and subcutaneous cellulitis, some inflammation under the skin, that for sure that cellulitis is inflammation and infection and destruction of the tissue, right? So this will also be causing you chest pain. Herpes zoster, some people are suffering from herpes infection, and it is also really very severe condition that can cause chest pain. And then abdominal chest pain, myositis is a muscle one, and then costal cartilage, costal um, is rib due to the rib cage, right? Is here is also written is a rib fracture, and some kind of multiple myeloma. So this all are like the chest wall diseases that can be uh, causes of chest pain. Okay, so the next thing here is the chest pain characteristics. This is very important. That what is the chest pain characteristics? Chest pain fixed in the lesion where the site with tenderness. So it will be fixed where there will be the lesion, but it will be with the tenderness, right? Number second is thoracic activity. You have to be seen, like for example, breathing, coughing, arm movement, when the pain intensified, like mainly inflammation, trauma caused. Like for example, when there is inflammation or some trauma or something with the movement. For example, your rib is broken in the chest. So when you will move your arm or you will breathe, there will be pain in the thoracic cavity. Okay. So this is the fixed chest pain, but it will be with the tenderness. Okay, tenderness means when you move or when you touch, you will feel the pain. Next, cardiovascular diseases, angina pectoris, and then acute myocardial infarction, myocarditis, acute pericarditis, mitral or aortic valve disease, thoracic aortic aneurysm, pulmonary hypertension, and cardiac neurosis. So in the medicine, we will detailedly talk on these diseases one by one. So these are the actually diseases that can cause you chest pain, and these are the cardiovascular diseases. So mostly the most important disease here that you will be seeing in the clinic is angina pectoris, and then in the next one is acute myocardial infarction. So especially the acute myocardial infarction, if some patient present to you in the clinic and he say is that I am feeling the pain like some knife in my chest, so this kind of severe pain, you should directly like suspect about myocardial infarction. Okay, so myocardial infarction is what when some tissue of the heart, okay, cause necrosis, okay, or die due to the vascular compromise, is not getting enough oxygen and blood. So then this tissue of the heart will die. So this is a kind of one of the heart attack that will be presenting in the clinic. And angina pectoris, like there's angina, this pain is like this. The patient tells you, like for example, if it is a stable angina, that I walk, and then after some time when I start feeling pain in my chest, but when I take a rest, this pain goes away. And some angina types, like the patient even rest condition, or he is doing some exercise, he will all the time like he will be feeling the pain, right? So this kind of complaint, when the patient tells you, so you can better go for the more cardiovascular examinations. Okay. Next is two types of cardiogenic symptom: ischemic and non-ischemic. Cause of the chest pain that ischemic is, can you tell me? Very good. So ischemia is when the blood supply to some tissue is stopped, and then that causes the decrease oxygen. Like the blood carry the oxygen to the tissue. When the oxygen's blood supply to the tissue is stopped, automatically the oxygen supply will also be the stop, and that will cause the tissue death or necrosis. This is called ischemia. So myocardial infarction, coronary artery disease or angina pectoris, and then aortic stenosis and coronary vasospasm. Vasospasm means suddenly the vessels get in the condition of severe contraction, and hypertrophic cardiomyopathy, in which your heart size will increase bigger. And then non-ischemic causes of the chest pain include pericarditis and then dissecting aortic aneurysm and mitral valve prolapse. So damage of the mitral valve or aortic aneurysm, or maybe due to pericarditis, inflammation, the pericardium. These all causes are the non-ischemic causes that can also cause cardiogenic symptoms. So typical and atypical presentation of ischemic chest pain. Typically, you will be feeling pain in this region of the chest, right? And atypically, this pain will be in the, you can also sometimes the back pain, right? So this can also happen. Not necessary that this pain will always be in the front chest area. No, sometimes the back pain can also be the cause of cardiac problem, ischemic chest pain, right? Okay, ischemic symptoms. Now you will ask what are the symptoms here. MI may go unrecognized. Sometimes symptoms are delayed for many hours. Sometimes myocardial infarction may be silent, okay, unrecognized, and symptoms may be appear for for hours, delayed for many hours. Three main types of MI: anterior wall, inferior wall, and lateral wall. Is this the talking about the heart size, hearts, which side it is occurring, right? So most commonly the anterior, inferior, and lateral side of the heart you will get MI. Anterior MI often present with chest pain and dyspnea due to the left ventricular involvement. Like the anterior MI, because it's is involved in the left ventricular side, so it will cause shortness of breath with chest pain. But inferior wall MIs often present with chest pain and then diaphoresis and hiccups, right, due to the possible vagus nerve involvement. So this is the feature of inferior wall MI. Okay, I have not written there, but you just like this inferior MI, but actually it's an inferior wall MI. So diaphoresis means sweating. Okay, so it will be a lot of sweating at the same time. This patient will be presenting, and he will be nervous. Yeah, if someone has asked that chest pain is related to cardiac disease or the respiratory disease, my friend, in the beginning of this lecture we have already talked that it can be chest wall problem, it can be cardiac problem, it can be mediastinal problems, it can be gallbladder problem, it can be pancreatic problem. All these things can cause you chest pain. Okay, lateral MI often presents with chest pain and left arm pain. It is very commonly seen that the patient will come chest pain that will be radiating to your left arm. If this kind of condition, you better directly go for ECG to find out that whether it is a myocardial infarction or not. But sometimes it is not necessary or all the time that the chest pain that is radiating to the left arm is cardiac problem. It can be um, no, it may be in some scenarios it's not a cardiac presentation. Symptom presentation frequently with MI is diaphoresis, sweating 78%, chest pain 64%, nausea 52%, and sometimes asymptomatic. You will get MI, you will die without even knowing it, without any symptom. Is a 25% occurring case there. So this is about the cause. You see, this is the heart, and this is, I think, the front side of the heart. So maybe this is the anterior descending coronary artery. So what is happening here? You see the plaque formation within the vessel. So this is the vessel true lumen. So it's narrowed. So for example, this area here, it is narrowed from here. So will the blood will reach into this area? Of course, it will not reach there, and this area will get less blood supply, blockage, and the patient will have a myocardial infarction. If it is not timely treated, the patient may die there. Okay, so left coronary artery, again right coronary artery. These are the marginal artery. I think this anterior descending artery is your aorta. So what happens is plaque formation, the same story that I have already told you. Typical angina. So now you see angina, what is the typical cardiac pain areas is this area of the chest. Possible area radiating pain. The pain may also be radiated is neck, jaw, upper abdomen, shoulders, and arms. So this one is possible places that with the chest pain, the pain will radiate to the other places, right? Okay, chest pain characteristic. Most of the pain is in the sternum, the precordial area, and few can be in the xiphoid and the left shoulder arm radiation. So most of them then the sternum bone, that is also called the breastbone, in front of your chest. So most of the chest pain in this area. Precordial area means the area that where there is a heart, right? So in this area maybe you can find, and then can be in the xiphoid. So you can see is like this. For example, this sternum bone. The sternum bone has three parts: manubrium, artery, and xiphoid. A small projection, that is the end part of the sternum. There you can also get the pain. Okay, so number two, often due to physically activity induced or exacerbated, improved, or stop after the break. So this actually this term here is used as improved or stop after the break is the pain that is about the angina pectoris, right? But the myocardial infarction, no matter you are taking rest or not taking rest, that pain will never stop. Location, I have already told you. Number one is the sternum. Number two, radiation will be what? Left shoulder, left arm side of the fourth five fingertips. So this one is the classical presentation of cardiac pain. And nature and characteristics here: squeezing pain accompanied by sense of suffocation. So you will feel like shortness of breath. Angina pectoris duration is short, a few minutes, no more than 30 minutes. And acute myocardial infarction is more severe with fear of dying. So this is the difference between these two diseases. But myocardial infarction pain is really unbearable. Is a very sharp kind of pain. But angina pectoris pain, it's okay, it can be tolerable. D. You will also get emotional with this pain. I will be feeling of fullness, and then you will also feel cold. Okay, so this incentives and relief, rest, and also we give to these chest pain patients, we give them nitroglycerin drugs. So what does the nitroglycerin cause? Any one of us. Nitroglycerin will dilate blood vessels, and then when it will dilate blood vessels, what will happen then? The area
It then
which is ischemic,
it
right?
then yeah it then facilitates the blood vessel to be dilated, and when there is a vessel constriction, it will be dilated, facilitating enough blood flow to the deprived myocardial tissue.
Very good, very good. So this nitroglycerin will dilate the blood and more facilitate more blood towards that area. So that area will get more oxygen, and the ischemia condition will get better, and patient will be relief from the pain. Good. And primary disease, high blood pressure, coronary atherosclerosis, heart diseases, and G is ECG, myocardial ischemia. Respiratory. Now we have studied the cardiac diseases. Let me see how much time left. Okay, 7 minutes. So now we will talk the respiratory diseases. What other causes, other things that can cause the chest pain? Is pleurisy, and then pleural tumor, and spontaneous pneumothorax, and then pulmonary thrombosis, pneumonia, acute tracheal bronchitis, and lung cancer. So these all diseases, they can, like certain tumors, some pneumothorax, when the air entry into the chest area where they should not be there, for example, between the pleura, right? So this will compress the heart and lungs and causing the difficulty breathing, and then thrombosis and pneumonia, infection of the chest. So this all things are the respiratory problems that can cause you the chest pain, right? So you see as a little bit anatomy. So you see is the right lung, ribs, and this all thing. So you see small pneumothorax. Normally the lungs should be like this, but you see now there is a black area. Even in the X-ray you can see the black area. What happened? This lungs is not fully inflated because here the extra air has been entered into the lungs. So it is a very big topic. Now we will not go to the detail of this thing, closed pneumothorax, open pneumothorax, spontaneous, this, that, a lot of information, but just simply understand here. It's here, as you see now, there's a lot of air, and it compressed the lungs. This is the lung, so small. So almost this lung is not even able to inflate. So you will get lot of difficulty in chest pain, right? So you see a lot of air collects and pushes the lungs and the heart, right? So it will also push the heart, and you also get chest pain. Okay, so treatment, how we will do, we will push a tube or needle into the chest and remove out this air. Sometimes we use the air water seal bottle to connect the tube, and slowly the air will be out of the chest and lung will be fully inflated, and the problem will be solved. Now pulmonary embolism is a simple thing, the embolus in the you know some vessels of the chest or lungs, and that will cause the blocking effect, and after that necrosis, and then tissue death, and the same story, right? So this will also be very severe chest pain you will experience. Pneumonitis is the inflammation of the chest. So you see this a normal chest. Here you can see is more blurred and hazy and lot of infiltrates here. So pneumonitis is the inflammation of the chest wall. So this will also cause you the chest pain. Chest pain characteristic here is cough. You see the main thing in the cardiac one is you will get a dyspnea, right? Like difficulty breathing. Here there will be also difficulty breathing, but mostly you will get is a cough, deep breathing increase often, and then chest wall without tenderness. Okay, here the chest wall will be without tenderness associated with symptom and sign of primary diseases, for example cough, fever, difficulty in breathing, and hemoptysis and so on. So coughing of the blood, right? So this kind of symptoms will be here that will differentiate this chest wall, this disease from the other cardiac disease, right? This is the respiratory problem. So this, if you get a fever, cough, and this all things and hemoptysis, so simply you can guess that it is not a cardiac disease. It's a respiratory problem. And physical examinations can be found positive sign like X-ray or CT examination can find the lesions in the chest area. Okay, so this is about the chest pain characteristics. Okay, let me see how much left, if it is more or less. Okay, mediastinal diseases, mediastinitis, mediastinal abscess, mediastinal tumor, esophageal hernia, esophageal hernia, and so on. So this mediastinum, now I will not discuss on too much. I will make a video for you what are the structures in the mediastinum and what is actually a mediastinum, right? The anatomy of the mediastinum, and after that we will discuss on this. Chest pain look characteristics here. After the sternum, sustained pain. This pain will be sustained, right? And pain is this is wrong here. Pain is burning pain. Eating or swallowing will increase the pain and will be the difficulty swallowing if the mediastinum structures are involved, right? And reflex esophagitis is a burning after the sternum, like after a meal. Supine or prone position increase the pain, and taking antacid and booster drugs, pain can be reduced or disappear. Like let's see, this pain you will feel behind the sternum, right? In this area, same area, it will like you will feel like a cardiac pain, a burning and heavy sensation behind the sternum, right? Heavy, mostly you will get is a heavy and burning sensation. What is reflex esophagitis? Like sometimes the acid from the stomach, it will reflex back to your esophagus and will burn the esophagus, right? So this kind of burning sensation, we also call this disease is a GERD. Have you heard about GERD? Gastroesophageal reflux disease. Okay, it's very common these days because the people using lot of the oily things and these kind of spicy foods, so they can get this reflex esophagitis as well. So we take antacids, right? Or you can take some, for example, omeprazole or something like this. This pain will be quickly relieved suddenly. It's like after the taking drug, you will feel the pain is relieved quite nicely. So this kind of pain in the chest, which is behind the sternum, and then some, like you can get with the burning pain, and after the antacid, this kind of pain. Okay, so the chest pain assessment, it is essential to obtain a throughout assessment that include the characteristic of the plane, including location, duration, radiation, quality, and accompanying symptoms. So it is very important because this will give us a clue that which kind of chest pain is it. Is it a chest wall problem, or it is a cardiac problem, or it's a mediastinal structure problem. Carefully observe for associated symptom, heavy pressure or squeezing in the chest area, episodic or exertional triggers, diaphoresis, weakness, anxiety, and palpitation, because this will help you to differentiate it from the cardiac pain. Or just can, for example, let's see, there's a lot of like diaphoresis and something like that. Maybe there's a cause of MI, and then the episodic or exertional trigger. This can give you the clue for angina, right? So this all keys can help you, and specific areas can help you to quickly reach to your diagnosis. Chest pain with diaphoresis is the most common presentation with acute MI. Often the patient will describe the pain using the Levine sign, placing a clenched fist over the sternum. So he will just like this kind of sign. He will be showing the clenched fist over the sternum, that this kind of squeezing pain. So this will differentiate you, help you to differentiate it from the other problems. Asking points, journal information, age of onset, where it may happen, rapid onset, incentives, aggravating or elevating way, like elevating factors. So these are very important. For example, the chest pain, which can be like, for example, elevated, which can be relieved by taking a rest. So it may indicate that it is angina pain or pain of the chest, which is relieving with the antacids. So it means that this pain is gastroesophageal reflux disease due to the acid regurg. Chest pain performance, site, nature, extent, duration, and whether to find that this is a radiating pain or not. And accompanying symptoms like respiratory, cardiovascular, digestive, and other system symptoms and degrees. So thank you very much. So today our lecture is over. I hope you have learned something from this lecture. So always compare. Your task is to compare that what can be the respiratory signs, like coughing, etc. What can be the you know esophageal problem, like burning, or the chest wall problem, like herpes zoster, and these all things, and cardiac problem, which kind of pain, radiating pain, and it is burning pain, specific areas, all these things. Make a table and compare with each other, and then in the future we will discuss some cases that I will give you, and let you to find the answer, that which kind of disease these patients are suffering from. Thank you. Have a good day.